A patient today asked about treatment options for panic attacks. After discussing behavioral modification, like decreasing caffeine, increasing exercise, and we also talked about psychotherapy in terms of something that could be very helpful for treating anxiety disorders and mindfulness as well. We talked about some of the medication options. And I wanted today to go over some of the non-controlled, so non-addictive forms of pharmacotherapy for anxiety disorders and specifically for panic attack disorder. One option are your SSRIs, your selective serotonin reuptake inhibitors. These are medications like Prozac, which is fluoxetine, Zoloft, which is sertraline, Paxil, which is paroxetine, Lexapro, which is escitalopram, Celexa, which is citalopram. You also have SNRIs, which are very similar to your SSRIs, but also increase the availability of norepinephrine. Medications in that category include Cymbalta, which is duloxetine, and Effexor, which is venlafaxine. But then you have some other medications, and one of those medications, or types of medications, are called beta blockers. Beta blockers are traditionally medications that are used to treat tachycardia, so a very fast heartbeat, heart rhythm, and also used for high blood pressure or hypertension. These medications will block your beta receptors on your heart and on your lungs, and those are the receptors that, when triggered, will cause your heart to start beating really fast. They'll cause your lungs to really open up so you can get a lot of air and start driving oxygenated blood to your muscles in a situation where you would need to. Other medications we talked about were hydroxyzine, which is Vistaril. Hydroxyzine is a medication that is chemically similar to Benadryl, actually, or diphenhydramine, but is FDA approved for anxiety. And we even talked about some off-label medications, like gabapentin, which you do have to be careful about utilizing because for some individuals, it does have some abuse potential, but likely less than your traditional anxiolytics like Xanax, which is alprazolam, Klonopin, which is clonazepam, Ativan, which is lorazepam, or Valium, which is diazepam. So those are medications that also treat panic disorder and panic attacks, but they have significant abuse potential and can make someone pretty physiologically dependent as well. So we talked about all those different options, and there's obviously a lot to think about when someone wants to treat panic disorder with medication, and it's obviously pretty complex. So if you believe this video pertains to you in any way, be sure to talk to a medical professional directly and to set up an evaluation with a medical professional.